Hello everyone, welcome back to Healthy Care. Is your body trying to send you a message that you've been ignoring? What if recognizing that message could be the key to saving your life? Today on Healthy Care, we're diving into 15 crucial warning signs that many people overlook, signals that could point to cancer. Some cancers, like pancreatic or brain cancer, are experts at hiding until it's too late, making it all the more important to know what to watch for. Now we get it, every small symptom can feel alarming when you turn to the internet. That's why this video is here to give you clarity. We're sharing evidence-based warning signs, the same signs that have helped countless individuals detect cancer early and take action when it matters most. You don't want to miss this. Let's jump in and empower ourselves with the knowledge to protect our health. 15. Persistent fever. A persistent or recurring fever that defies explanation could be your body's way of signaling blood cancer. Unlike typical fevers that resolve within a few days, cancer fevers often follow a distinct pattern and may accompany other systemic symptoms. Leukemia and lymphoma can trigger your immune system to release chemicals called cytokines, leading to frequent fevers. These fevers might occur without any apparent infection, and often accompany other symptoms like night sweats or unexplained weight loss. The pattern might include temperature spikes at regular intervals, known as cyclic fever. When a fever persists beyond 2 weeks or returns repeatedly without a clear cause, it warrants medical investigation. Blood cancers can compromise your immune system, making you more susceptible to infections while also directly causing fever. Proper evaluation often includes blood tests to check for abnormal cell counts and other markers of disease. 14. New or unexplained pain. Is there a pain that's been bothering you without any apparent cause? Pain that doesn't have an obvious reason, like an injury or illness, and doesn't respond to regular treatments, should be evaluated by a doctor. Pain is your body's way of signaling that something is wrong. If you have pain that lingers without explanation, it could be a sign of cancer. For example, abdominal pain could indicate prostate, bladder, testicular, or penile cancer in men. In women, unusual pain or sensitivity in the breasts might be a symptom of breast cancer. This pain isn't typical and doesn't go away with usual remedies, indicating that something more serious might be happening. Pain can also be a symptom of internal cancers. For instance, a persistent feeling of heaviness or swelling in the scrotum could signal testicular cancer. Similarly, ongoing pain in the abdomen might suggest issues like liver or pancreatic cancer. These types of pain are often overlooked or attributed to less severe causes, but they warrant a closer look. Ignoring unexplained pain can be dangerous. It's easy to dismiss pain as a minor issue, but if it persists and isn't linked to a known cause, it needs to be investigated. 13. Changes in urinary or bowel habits. Have you noticed any changes in your bathroom habits lately? Changes in your urinary or bowel habits can be an early sign that something isn't right in your body. If you experience constipation or diarrhea that lasts for several weeks, it's time to see a doctor. These symptoms might seem minor but can indicate serious underlying conditions, including cancer. Changes in bowel habits could be a symptom of inflammatory bowel disease, like Crohn's disease. However, they can also signal colon or stomach cancer. These cancers can cause disruptions in your digestive system, leading to noticeable changes in how often and how comfortably you can go to the bathroom. There are 3 types of cancer pathways with 5 different phases. Phase 1. Similarly, changes in urination such as pain when urinating, increased frequency, or a weak stream, could be signs of urinary tract issues. These symptoms might indicate an enlarged prostate, a urinary tract infection, or more seriously, prostate or bladder cancers. If you notice these changes, it's essential to get them checked. While these symptoms can be caused by less serious conditions, they might also be early warning signs of cancer. It's always better to investigate and rule out serious issues than to ignore symptoms and risk the progression of a potentially treatable condition. Being proactive about your health means paying attention to your body's signals. If you experience any persistent changes in urinary or bowel habits, consult a healthcare provider. Early detection and treatment can significantly improve outcomes for conditions like colon, stomach, prostate, and bladder cancers. 12. Persistent headache. Do you have a headache that just won't go away? A headache that lingers despite taking over-the-counter or prescribed medications can be alarming. If you find yourself with a persistent headache lasting more than 2 weeks, it's time to see a doctor. This type of headache could be a warning sign of something more serious, such as a brain tumor or other brain cancers. In addition to the headache itself, other neurological symptoms can accompany it. These might include blurred or double vision, changes in hearing, or facial drooping. If you experience any of these symptoms alongside a persistent headache, it's essential to get them checked out promptly. Seizures or other unusual neurological events should also be evaluated by a healthcare professional. These symptoms can indicate changes in the brain that need immediate attention. Brain tumors can press on nerves and disrupt normal brain function, leading to these types of symptoms. Ignoring a persistent headache and associated symptoms can be dangerous. While not all headaches are related to cancer, those that don't respond to typical treatments and last for an extended period should be investigated thoroughly. Early detection can make a significant difference in the treatment and management of brain tumors and other related conditions. Listen to your body and recognize when something isn't right. If you have a headache that persists and comes with other neurological symptoms, don't delay seeking medical help. It's always better to be cautious and ensure that you receive the appropriate care. 11. Persistent fatigue. Have you been feeling unusually tired lately? Persistent fatigue can be one of the earliest signs that cancer is growing in your body. If you notice that your energy levels have plummeted, and no amount of sleep or rest seems to help, it's time to pay attention. This isn't the usual tiredness from a busy day. It's a deep, unrelenting exhaustion. This fatigue can be particularly indicative of cancers like leukemia or lymphoma. These cancers affect the blood and bone marrow, disrupting your body's ability to produce healthy blood cells. As a result, you feel worn out, no matter how much you try to rest. In addition to fatigue, you might also experience muscle weakness or confusion. These symptoms can be related to cancers that impact hormone levels or cause internal bleeding, such as colon or stomach cancer. When cancer disrupts your body's normal functions, it can lead to a constant state of tiredness and other related symptoms. However, here's the tricky part. Persistent fatigue is often mistaken for stress or overwork. If you find yourself unusually tired for an extended period, it's crucial to consult a doctor. They can perform the necessary tests to determine if there's an underlying issue that needs to be addressed. 10. Fingernail marks. Subungual melanoma, a form of skin cancer that develops under the nails, often starts as an innocuous-looking streak. This dark line, known medically as melanonychia striata, runs vertically along the nail and requires careful monitoring. Melanonychia striata. Unlike normal nail pigmentation, cancerous streaks typically appear suddenly and continue to evolve. The most common location for subungual melanoma is the thumb or big toe, though it can occur on any nail. What makes this particularly dangerous is how easily it can be mistaken for normal nail trauma or fungal infection. The key warning signs include a dark streak wider than 3 mm, varying colors within the streak, or blurred borders. Understanding Hutchinson's sign is crucial. This refers to when the dark pigmentation extends beyond the nail onto the surrounding skin. If you notice any nail changes accompanied by pain, splitting of the nail, or bleeding, don't wait to seek medical attention. 9. Bone pain. One of the most overlooked signs of potential cancer is persistent bone pain. Unlike the temporary discomfort from exercise or minor injuries, cancer bone pain typically intensifies over time and often worsens at night. When cancer originates in or spreads to the bones, it disrupts normal bone tissue structure, causing a deep, penetrating ache that's hard to ignore. Primary bone cancer, known medically as osteosarcoma, typically affects the long bones in the arms and legs. The pain may start subtly, sometimes feeling like a sprain or muscle ache, but gradually becomes more severe and constant. This type of pain can affect your daily activities, making simple movements increasingly difficult. Some patients describe the sensation as a throbbing or aching that doesn't respond to typical pain relievers. If you notice bone pain accompanied by swelling, increased tenderness, or unexplained fractures, it's crucial to seek medical attention promptly. Early detection of bone cancer significantly improves treatment outcomes, with survival rates much higher when caught in the early stages. 8. Eye pain. Your eyes can reveal crucial information about your overall health, including potential signs of cancer. Ocular melanoma, though rare, is the most common primary eye cancer in adults. The symptoms often begin subtly but can progress to more noticeable changes that shouldn't be dismissed. When cancer develops in the eye, it can cause various distinctive symptoms that differ from common eye problems. 1. You might experience blurred vision that doesn't improve with new glasses, or see strange flashes of light that can't be explained by migraines. The most concerning sign is the development of a dark spot on the iris that gradually changes in size or color. Advanced imaging techniques, like ophthalmoscopy, allow doctors to examine the internal structures of your eye. If you have lighter colored eyes or fair skin, you're at higher risk for ocular melanoma. Don't ignore persistent eye pain or vision changes. Early intervention can preserve both your vision and your life. Regular eye examinations are particularly important if you have risk factors like prolonged sun exposure or a family history of eye cancer. 7. Excessive bruising. Have you noticed bruises appearing out of nowhere? Excessive bruising in unusual places on your body can be a sign of certain blood cancers. If you notice bruises appearing without any clear cause, it's important to see a doctor. These types of bruises can indicate issues with your blood cells, such as leukemia. Leukemia affects your body's ability to produce healthy blood cells, leading to symptoms like excessive bruising. Bruises might appear on your arms, legs, or other areas where you wouldn't typically expect to see them. This symptom should not be ignored, as it can be an early sign of a serious condition. In addition to bruising, you might notice other symptoms such as frequent nosebleeds or bleeding gums. These can also be signs of blood disorders or cancers. If you experience any of these symptoms, it's crucial to get them checked out by a healthcare provider. Pay attention to changes in your body, including unexplained bruising. If you notice bruises appearing frequently in unusual places, consult a healthcare provider. Early detection can make a significant difference in treatment and outcomes. 6. A cough or hoarseness that won't go away. Have you been battling a cough that just won't quit? A persistent cough or hoarseness that lingers for more than 2 weeks should be evaluated by a doctor. If you have a dry, hacking cough that doesn't improve, it might be a sign of lung cancer. Coughing up blood or bloody discharge is particularly concerning and needs immediate medical attention. Hoarseness or a raspy, strained voice that doesn't go away can also be a warning sign. If you notice changes in your voice, especially if accompanied by difficulty swallowing or pain in your neck or throat, these symptoms could indicate thyroid or throat cancers. Persistent coughing and hoarseness are often overlooked as minor issues. However, When these symptoms persist, they can be indicative of more severe conditions. Lung cancer in particular can cause chronic coughing that doesn't respond to typical treatments. Listen to your body, and don't ignore persistent respiratory symptoms. If you have a cough or hoarseness that lasts more than 2 weeks, consult a healthcare provider to determine the underlying cause and appropriate treatment. 5. Blood in the urine or stool. Seeing blood where it shouldn't be is always a cause for concern. Noticing blood in your urine or stool can be alarming, and should never be ignored. Blood in the stool can appear black, tarry or red, and blood in the urine can be pink, red or dark brown. These symptoms could be indicative of serious conditions, including cancer. Blood in the stool may signal digestive system cancers such as colon or rectal cancer. It can also be a sign of inflammatory bowel disease or ulcerative colitis, which disrupt the normal functioning of your digestive tract and can lead to bleeding. Similarly, blood in the urine can be a sign of prostate or bladder cancer. It can also indicate infections or other urinary tract issues. The presence of blood is a signal that something is wrong and needs to be evaluated by a healthcare professional. If you notice blood in your urine or stool, don't delay seeking medical advice. These symptoms require prompt evaluation to determine the underlying cause and appropriate treatment. Your health is too important to ignore these warning signs. 4. Mouth sores that won't heal. Have you noticed any sores in your mouth that just won't go away? Mouth sores that don't heal within a couple of weeks should be taken seriously. If you notice persistent sores, lesions or white patches on your lips, tongue, gums or elsewhere in your mouth, it's time to get them checked out. These symptoms could indicate oral cancer. Oral cancer can develop in any part of the mouth, including the lips, tongue, and throat. If you use tobacco or drink heavily, you are at a higher risk for this type of cancer. Persistent mouth sores are not something to overlook, especially if they come with other symptoms, like difficulty swallowing or unexplained weight loss. White patches in the mouth, known as leukoplakia, can also be a warning sign. Leukoplakia is a precancerous condition that can develop into cancer if left untreated. These patches might appear harmless, but need to be evaluated by a healthcare provider to determine the appropriate course of action. Ignoring mouth sores can lead to severe consequences, as oral cancer can be aggressive. Early detection is key to successful treatment. If you have sores that don't heal, seek medical advice promptly. 3. Persistent heartburn. Chronic heartburn, medically known as gastroesophageal reflux disease, GERD, might seem like a mere inconvenience, but when it persists despite lifestyle changes and medication, it could signal something more sinister. Esophageal cancer often first manifests as persistent acid reflux that doesn't respond to normal treatments. The relationship between chronic heartburn and cancer lies in the repeated damage to your esophageal lining. Over time, stomach acid can cause changes in the cells lining your esophagus, leading to a condition called Barrett's esophagus. This precancerous condition significantly increases your risk of developing esophageal adenocarcinoma. Watch for warning signs like difficulty swallowing, food getting stuck, or unexplained weight loss alongside your heartburn. If you've been treating heartburn with over-the-counter medications for more than 3 weeks without improvement, it's time to consult a healthcare provider. 2. Jaundice. Have you noticed a yellowing of your skin or eyes? Jaundice, characterized by yellowing of the skin and eyes, occurs when bilirubin builds up in your body. While jaundice can result from various conditions, its sudden appearance in adults often raises red flags for pancreatic or liver cancer. In pancreatic cancer, tumors can obstruct the bile duct, preventing bilirubin from being properly processed and expelled. This backup causes bile to enter your bloodstream, turning your skin and the whites of your eyes yellow. The color change often starts subtly but becomes more pronounced as the condition progresses. The pancreas's location, deep within your abdomen, means early cancer detection can be challenging. That's why recognizing jaundice, especially when accompanied by upper abdominal pain, dark urine, or light-colored stools, is crucial. 1. Body rash. When it comes to skin changes, certain types of rashes deserve immediate medical attention. Leukemia, a cancer affecting blood-forming tissues, can manifest through distinctive skin symptoms that many people mistakenly attribute to minor conditions. The key difference lies in how these rashes appear and behave. Petechiae, tiny round spots that appear on the skin, result from platelet deficiency, a common feature of leukemia. These spots typically measure 1 to 2 millimeters, and don't blanch or fade when you press on them. The color ranges from red to purple or brown, and they often cluster together in areas where pressure is applied, such as the ankles or around tight clothing. Understanding the mechanism behind these spots is crucial. Leukemia disrupts your body's ability to produce healthy platelets, which normally help prevent bleeding. Without adequate platelets, tiny blood vessels called capillaries can leak, creating these characteristic spots. Unlike common rashes that might itch or fade within days, leukemic rashes persist and may be accompanied by other symptoms, like unexplained bruising or bleeding. Thank you for staying with us until the end of this vital discussion. Recognizing these signs early can truly be life-saving, and your awareness is the first step toward better health. Remember, your body communicates with you in subtle ways, and listening to those signals can make all the difference. If any of these symptoms resonate with you, or someone you know, don't hesitate, consult a healthcare professional as soon as possible. If you found this video helpful, please give it a thumbs up and share it with your loved ones. Spreading awareness could save lives. Don't forget to subscribe to our channel and hit the notification bell to stay updated on crucial health topics. Together, we can create a healthier, more informed future. Thank you for watching, and take care of yourself and those around you. See you in the next video.